Hi, today I will demonstrate how we treat acne scars with PRP. Acne scars can be of different types, and our patient here, who is no one but our famous Nadia, has some acne scars of the roll types or the atrophic type. And that type tends to improve with PRP. What is PRP? We take blood from Nadia's arm, remove the red blood cells and white blood cells, and what we're left with is this yellowish clear liquid. This is what we call the juice of the blood, because it has all the nutritional value of the blood that is circulating all over. It has growth factors, growth hormones, vitamins, minerals, everything that helps grow tissues and keep us healthy. So when we inject this PRP into the skin, we will allow the skin to heal itself and improve on those scars. So by stimulating new collagen, a new circulation that will allow for better remodeling of the scar. And a lot of people, just by doing PRP alone, see their scars improve. Sometimes we also do laser at the same time to combine two modalities that will give synergy. By doing laser, we're creating little holes in the skin, and as these holes heal, adding the fertilizer, the juice or the PRP will make those scars heal much better and develop better collagen. So I will show you how we do these injections. The skin has already been cleansed. Okay, so we go just below the scar, and it's not the most comfortable thing to do, but it's well tolerated, as you can see. The other thing we use this PRP for is to improve laxity, rejuvenate the skin, or for hair loss.